7 diabetes nighttime signs you shouldn't ignore. Did you know that over 30 million Americans have diabetes, with about 90 to 95% of them dealing with type 2? It's a staggering statistic, isn't it? Diabetes, a chronic condition, disrupts the body's glucose levels, and dismissing its symptoms can lead to severe complications down the line. As night falls, many people with diabetes find their symptoms kicking into high gear. It's like a constant battle, even when the lights are out. The evening hours unveil a distinct set of symptoms crucial for timely management and uninterrupted sleep. Recognizing these signs is vital to managing your condition and getting a good night's sleep. So let's delve into 7 crucial signs you shouldn't ignore when diabetes persists, regardless of the hour. Number 1. Night sweats. Experiencing chills and waking up drenched in sweat during the night is all too familiar for many with diabetes. Even on cooler nights, you might find yourself uncomfortably clammy, disrupting your sleep. But did you know several factors can cause your blood sugar levels to drop while you sleep? For instance, indulging in a glass of wine or beer before bedtime can halt your liver's ability to produce glucose overnight. If you've ever found yourself waking up in a cold sweat after a night out, this could be the reason. Similarly, if you're hitting the gym hard during the day, you might deplete your body's glucose stores. Failing to replenish these before bed could lead to nocturnal hypoglycemia. And for those managing diabetes with insulin, the risk of diabetic night sweats is heightened, as it's challenging to monitor blood sugar levels overnight. When glucose levels reduce, the body pumps out excess adrenaline, triggering sweats and other symptoms like headaches. But not to worry, effective blood glucose control is key to managing these night sweats. Simple adjustments, like altering your exercise routine or having a bedtime snack, can help make a big difference. Your doctor can also fine-tune your diet, exercise, or medications to minimize or eliminate night sweats. By the way, thanks for sticking around. Now, before we continue, we'd greatly appreciate it if you could take a moment to like this video and subscribe to our channel for more insightful content. Let's move on. Number 2. Nocturia. Nocturia, or the need to urinate during the night, can be a telltale sign of high blood sugar, especially in those with diabetes. When you have diabetes, your kidneys work overtime to eliminate excess sugar from your blood. This excess sugar ends up in your urine, causing your kidneys to produce more urine, even while you're catching some sleep. Having consistently high blood glucose levels can also lead to the excretion of excess glucose through urine, resulting in increased urine production. However, frequent urination due to high blood sugar can increase your chances of getting a urinary tract infection, which only intensifies the need to visit the bathroom at night. Now, there's a specific type of diabetes called diabetes insipidus. That's not tied to abnormal blood glucose levels, but it's still closely associated with nocturia. So if you're making midnight trips to the bathroom more often than usual, it could be a sign that your blood sugar levels need a closer look. Number 3. Increased thirst. When you have diabetes mellitus, your body struggles to regulate its blood sugar levels. This leads to a buildup of sugar in your bloodstream. To deal with this excess sugar, your kidneys step in and work harder to filter it out. As a result, you end up producing more urine than usual. Now, because you're producing more urine, your body loses water more rapidly. This triggers a natural response in your body: extreme thirst. Your brain senses the dehydration and signals that you need to drink more water to replenish what you're losing through urine. But it's not just diabetes that can cause this intense thirst. Conditions like central and nephrogenic diabetes insipidus can also mess with your body's water balance. In central diabetes insipidus, there's a problem with the production of vasopressin, also known as the antidiuretic hormone, which helps regulate water balance by reducing urine production. If your body isn't making enough of this hormone, you'll end up producing too much urine and feeling constantly thirsty. On the other hand, nephrogenic diabetes insipidus affects how your kidneys respond to vasopressin. Even if your body is making enough of this hormone, your kidneys may not be able to properly absorb it, leading to excessive urine production and thirst. Whether it's due to diabetes mellitus or other related conditions, the result is the same. You lose too much water through urine, which leaves you feeling incredibly thirsty. And the cycle continues. The more you drink to quench your thirst, the more you urinate, and the thirstier you become. Number 4. Restless Leg Syndrome. In the U.S., about 7 to 10% of the general population experiences RLS. But among those with diabetes, it's much more prevalent, affecting about 1 in 4 individuals. Restless leg syndrome, or RLS, can affect anyone, but it's more common in people with diabetes. While sometimes RLS has no definite cause, factors like age, certain medications, and health conditions including diabetes, peripheral neuropathy, kidney failure, and Parkinson's disease can contribute. RLS symptoms can range from an uncontrollable urge to move your legs to uncomfortable sensations that improve with movement, like aching, throbbing, itching, or electric shock-like pain. Furthermore, if you have diabetes and struggle with high blood sugar and insulin insensitivity, you may experience diabetic peripheral neuropathy, a type of nerve damage that often begins in the feet and moves upwards. This nerve damage can lead to abnormal signals being sent out, causing discomfort or pain in your legs and feet, making sleep elusive and exacerbating RLS symptoms. To manage RLS, those with diabetes must maintain targeted blood sugar levels of 70 to 180 milligrams per deciliter. This helps slow down nerve damage and may alleviate restless leg symptoms, improving sleep quality and overall well-being. Number 5. Extreme fatigue. Feeling constantly weary and exhausted, particularly at night, is a common experience for many with diabetes. It's important to distinguish between fatigue and tiredness. While tiredness typically improves with rest, persistent fatigue may persist regardless of how much rest one gets. In diabetes, high blood sugar levels hinder cells from effectively utilizing glucose for energy, leading to a sense of depleted energy reserves. This disruption can disrupt sleep patterns, exacerbating feelings of exhaustion and lethargy. Here's how it works. After eating, the body breaks down food into glucose, which cells utilize for energy with the help of insulin. In individuals with diabetes, either the pancreas doesn't produce enough insulin, or the body's cells become resistant to its effects, resulting in elevated glucose levels in the blood. When cells are deprived of adequate glucose, fatigue and weakness can set in. Diabetes medications, like insulin or metformin, help facilitate the movement of glucose into cells, preventing its accumulation in the bloodstream. However, these medications can sometimes lead to low blood sugar levels, known as hypoglycemia, which can also cause fatigue, particularly if episodes occur frequently at night or without warning. Even after treating low blood sugar, lingering fatigue may persist. Therefore, managing blood sugar levels effectively through medication, diet, and lifestyle adjustments is crucial for mitigating fatigue and maintaining energy levels in individuals with diabetes. Additionally, being vigilant about monitoring blood sugar levels and promptly addressing hypoglycemia can help alleviate associated fatigue symptoms. Number 6. Sleep apnea. Sleep apnea, a sleep disorder characterized by irregular breathing or shallow breaths during sleep, is another nighttime symptom often associated with high blood sugar levels, particularly among individuals with diabetes. This condition tends to worsen symptoms at night and is more prevalent among diabetic patients. Sleep apnea might be a warning sign for type 2 diabetes. So, if you find yourself snoring loudly, waking up often during the night, feeling extremely tired during the day, breathing through your mouth, or getting morning headaches, it's worth paying attention to. Besides messing with your sleep, sleep apnea can disrupt metabolism and contribute to insulin resistance, thereby increasing the risk of developing type 2 diabetes, as well as other serious health complications such as heart attacks, strokes, and certain cancers. Therefore, managing sleep apnea is essential for individuals with diabetes. One common treatment for sleep apnea is a continuous positive airway pressure or CPAP machine. This device involves wearing a mask attached to a hose and a device that delivers pressurized air, helping to keep airways open during sleep and alleviate symptoms of sleep apnea. If you suspect you have sleep apnea or are experiencing any of the associated nighttime symptoms, it's crucial to consult with a healthcare professional for proper diagnosis and management. Number 7. Nighttime hypoglycemia. Nighttime hypoglycemia, or low blood sugar while you're sleeping, can be pretty scary. You might wake up with a racing heart, covered in sweat, or even have nightmares. This drop in blood sugar can happen for a few reasons, like taking the wrong dose or timing of insulin, having too much diabetes medication, skipping meals, or drinking alcohol without eating enough food. If hypoglycemia isn't treated, it can lead to dangerous health problems like cardiac arrest, permanent brain damage, or even death. That's why it's super important to keep an eye on your blood sugar levels, especially at night, and to talk to your doctor if you're experiencing these symptoms. Now, it's crucial not to brush off any signs of diabetes, whether they show up during the day or at night. Keep your diet in check, stay active, and follow your doctor's advice on meds and monitoring. And if you notice any of the symptoms we talked about, especially if they seem to worsen at night, don't hesitate to reach out to a doctor or physician right away. And if you found this information helpful, be sure to share this video so more people can learn about it. Hit that like button and subscribe for more health tips in the future.